Welcome to our mnemonic video on diverticular disease. Let's begin. Our scene will take place at a diver center. In the early morning, an oxygen tank exploded, creating chaos in the place. In the foreground, we see a diver breaking and falling through the bottom of a chair as she startles from the explosion. The chair got broken and the diver's bottom sunk into the chair, appearing as if it's outpouching through the break. Well, diver sounds like diverticulum, which should remind you of the diverticular disease, an outpouching of the colonic mucosa and submucosa through the muscle layer, just like the diver's bottom here. Diverticula are found in areas where high intraluminal pressure is found, with the sigmoid colon being the most common place. Throughout this video, we will be discussing the diagnostic workup and treatment plan for a patient with diverticular disease. So let's start by discussing the diagnosis. Behind our diver, we see a man carrying an abacus with white and red beads, our recurring symbol for complete blood count. He's using the abacus to count the damages caused by the tank explosion. Notice that attached to his abacus is floating white balloons and deflated red balloons. White balloons like these are our recurring symbol for white blood cells, and the fact that there are a bunch of them should make you think of elevated white blood cell count or leukocytosis associated with diverticular disease. Red balloons, on the other hand, represent the red blood cells. And since they are deflated, we can think of low red blood cell count or anemia associated with diverticular disease, which often results from blood loss secondary to the disease process. Embarrassing moments should never go undocumented, and this is no exception. An onlooker has come equipped with his selfie stick to document our diver's fall. Notice that his selfie stick is shaped like a colon with a camera at the top, which should make you think of colonoscopy. Also notice his OK hand gesture, which is here to remind you that definitive diagnosis of diverticular disease is achieved with colonoscopy to directly visualize the diverticula in large bowel, most often occurring in the descending or sigmoid colon. It looks as though another diver has fallen through his chair, but the consequence was much more than some minor embarrassment. As he startles and falls, the explosion sends flames all around and below his seat. Just look at how his bottom is outpouching through the broken chair and right down into the flames. Flame should remind you of inflammation, and the fact that it's affecting the outpouching bottom of this diver should make you think of an inflamed diverticulum, also known as diverticulitis. Also notice the onlooker who came to record this moment is now thinking twice about getting too close. He and his colon-shaped selfie stick are staying away, which should remind you that colonoscopy and sigmoidoscopy are avoided during acute inflammation due to perforation risk. Taking a break from all the commotion, take a look at the showers in the background of our scene. Notice that the shower is shaped like a giant CT machine to help remind you that in case of acute diverticulitis where endoscopes are contraindicated, CT is the best diagnostic step. Running toward the CT shower is a diver with flames over his belly. The flames on his abdomen and the fact that he's stepping into the CT shower should remind you that a positive abdominal CT in the setting of diverticulitis will show inflammation. Also notice that someone left a mess of sand in the shower that looks like an abscess, reminding us that a positive CT may also show abscess formation. Now that we've discussed the diagnostic workup, let's talk about treatment. Here comes a calm diver who must have missed all the chaos. Just look at her in the middle of the scene eating her healthy, high-fiber lettuce. Her choice of cuisine should help us remember that treatment for uncomplicated diverticulosis requires routine follow-up and encouragement of a high-fiber diet to prevent constipation. Although she's calm, she seems a little surprised by something, so let's check that out. One of the divers injured his belly while fleeing the fire. He is bleeding and his blood created a trail behind him. A worker at the center brought him a chair and is offering him water while holding a bag of blood just in case. This idea of a bleeding diver should remind you of diverticular bleeding. And the fact that this worker is offering water and keeping the blood bag ready should remind you that diverticular bleeding often resolves spontaneously. However, proper hydration and the transfusion can be used as needed until bleeding ceases. Management of bleeding is done in an escalating manner, as you'll see in a minute, since the bleeding does not always stop, however. Looking behind our worker, we see a man coming in with his colon-shaped selfie stick camera, our recurring symbol for colonoscopy, to capture the intervention. This will help remind you that colonoscopy is needed to achieve hemostasis and stop diverticular bleeding if supportive therapy described previously fails. Though this man may be capturing the events for others to see, he isn't very helpful to the situation. Here comes a man with a plan to help. He is carrying a red hose with photographic camera in one hand and a scalpel in the other hand as he rushes toward the bleeding guy. A red hose is our symbol of an artery. Putting this with the photographic camera should help remind you of angiography. This idea is here to remind you that hemostasis can be achieved by angiography with embolization, depicted by this foam at the edge of the red hose. Finally, the scalpel is here to remind you of surgery, which can also be indicated to stop diverticular bleeding if all the preceding methods fail. Looking over to the canteen, we see that not everyone escaped the flames of the exploding oxygen tank. This diver is on fire, but he's also hungry, that he does not seem to be fazed by the flames at all. The cashier notices the fire and refuses to sell the flaming diver a snack, ordering him away to protect his shop from the flames. Remembering that our flaming diver represents diverticulitis. Refusing food to the flaming diver should remind you that treatment of diverticulitis involves keeping the patient NPO, or nil per os, in Latin that translates to nothing per mouth. Looking closer, we see this particular diver is not only unobservant, but also forgetful. He didn't have his snorkel, so we used straw instead, and we can see it still sticking out of his nose. That should remind you of a nasogastric tube, which is indicated in cases of severe diverticulitis. The cashier tells the flaming diver to hit the road, and we conveniently see a metro train off to the left to take him away. This metro train is our recurring symbol for metronidazole, one of the broad-spectrum antibiotics indicated for the treatment of diverticulitis to prevent sepsis. Hanging on the metro, we see a cephalopod holding a flower, representing the other two broad-spectrum antibiotics indicated here, a fluoroquinolone or second, third generation cephalosporin, respectively. A non-looker saw this interaction between the cashier and the flaming diver and thought injustice was afoot. He goes walking toward the counter with a colon-shaped selfie stick to record the incident, in case video footage would be needed later on. This should remind you that colonoscopy is indicated after the initial stage of diverticulitis, once the inflammation has subsided and the risk of perforation is eliminated. While all the drama unfolds at the canteen, we finally see an ambulance coming into the scene, our recurring symbol for hospitalization. Looking closely at the EMT accompanying the ambulance, we see that he is not looking so good. His green sweater and zombie-like appearance should make you think of systemic infection, and the fire on the belly of his sweater should remind you of peritonitis or inflammation of the peritoneum. This idea should remind you that both systemic infection and peritonitis are complications of diverticulitis and indications for hospitalization. Coming out of the ambulance, we see a surgeon with a scalpel to remind you of immediate surgery. Looking closely at his lab coat, we see a red heart on it. You could say the surgeon is a heart man, which should remind you of the Hartmann procedure, which involves surgical removal of diseased bowel. He is shutting the back doors of the ambulance and pointing his scalpel at the open side doors to remind you that the Hartmann procedure involves redirecting the colon from the rectum through a temporary colostomy. And with that, you should have all you need to know about diverticular disease diagnosis and treatment.